Hello everyone, how are you? Today we are going to talk about water soluble vitamins. So let's start first with vitamin B1, thiamine. So if a patient is vitamin B1 or thiamine deficient, he will have a condition called dry beriberi. And in dry beriberi, the most important problems that the patient have is the patient have a peripheral neuropathy. And if the nerves of the upper limbs are involved, upper limbs get emaciated, and also you can have wrist drop. If the lower limb is involved, lower limbs muscle gets atrophied and you can have foot drop, and also there is loss of tendon reflexes, and there may be some paresthesias. And there is also something called a wet beriberi, where there is heart failure. So whenever someone has a heart failure, he will have symptoms such as dyspnea, orthopnea, and he will have certainly edema. So you can see some edemas. So the patient is actually edematous. And in severe cases of thiamine deficiency, the patient can have Wernicke-Korsakoff syndrome, where there is actually lesion of the sixth nerve commonly, which can cause medial convergence of the eye. So there is ophthalmoplegia, and the patient is commonly confused, and sometimes they are confabulates. And also ultimately, if the condition is severe, it can lead to coma and death. And the problems that we are seeing in Wernicke-Korsakoff syndrome actually occurs due to degeneration of the mammillary body, and also sometimes degeneration of the medial dorsal nucleus of the thalamus. So let's look at the MRI. So here are 4 MRI. On the left side, there are normal MRIs, and on the right side, there are abnormal MRIs. So on the left side, you can see on the upper panel, you can see a sagittal MRI, where an arrow points towards the mammillary bodies. And in case of a patient who has Wernicke-Korsakoff syndrome, the mammillary body is a smaller one. Okay, and in the lower panel, you can see 2 mammillary bodies, and they actually get shrunken in a Wernicke-Korsakoff syndrome. Okay, so mammillary bodies, and also you can see the ventricles. The ventricles are smaller here, and they are larger because there is degeneration of the medial dorsal nucleus of the thalamus, which actually sits right here. Okay, let's move on. So this is a specimen where there is it shows the mammillary bodies here, 2 mammillary bodies which are actually degenerated in Wernicke-Korsakoff syndrome. Okay, next, thiamine actually is a very important cofactor for a lot of enzymes like dehydrogenases, and there is a mnemonic which is ATP, A for alpha ketoglutarate, enzyme needed for TCA cycle, T for transketolase, which is an enzyme needed in a special HMP shunt, and P for pyruvate dehydrogenase, an enzyme that degrades pyruvate and forms acetyl-CoA called acetyl-CoA to shift it to mitochondria, and it ultimately goes through TCA cycle. Another is branch chain keto acid dehydrogenase. Here is one important concept to know about. Whenever someone, especially some alcoholic, presents to you with vitamin B1 deficiency syndromes like Wernicke-Korsakoff syndrome, you must not infuse glucose before infusing thiamine or vitamin B1, because if you infuse glucose, a lot of glucose will actually form some intermediates like pyruvate, and pyruvate actually can get into the TCA cycle, and that's why pyruvate will actually go to lactic acid. So pyruvate will form lactic acid, and this lactic acid ultimately will cause cell damage. Okay, so most common cause of thiamine deficiency in the Western world is alcoholism. Alcohol actually decreases the absorption of thiamine, and also alcoholic patients have very bad dietary habit, which also leads to thiamine deficiency. And malnutrition is also a common cause, which is actually common in patients from poor countries. And you can diagnose thiamine deficiency by infusing vitamin B1 in a patient, and then there will be a rise of RBC transketolase activity. Okay, that's all about thiamine. Let's go forward. And this is vitamin B2 or riboflavin. If a patient is deficient of vitamin B2, the most common problem is angular chelosis or angular stomatitis. So here you can see some inflammatory features and some scalings. Okay, the patient can also have some corneal vascularization. So this is the limbus. Okay, this is the pupil, and in between the pupil and the limbus, this is the cornea. So this is the whole cornea, and you can see there's the vessels from conjunctiva and the sclera are coming towards the cornea. So cornea is normally an avascular tissue, and in case of vitamin B2 deficiency, there can be corneal vascularization. So remember that, very important. Now, vitamin B2 actually called riboflavin, and riboflavin is a part of FAD, flavin, adenine dinucleotide, and also flavin, adenine mononucleotide. Okay, so they form actually 2 ATPs, and the reactions are commonly redox reactions that vitamin B2 acts as a cofactor, and the most common reaction is succinate dehydrogenase, which is a part of TCA cycle. Vitamin B3 or niacin, it's a very important enzyme, very important vitamin, which can cause pellagra if deficient severely. And pellagra is characterized by 3D, which is dermatitis, diarrhea, and dementia. So here you can see a patient actually with a severe dermatitis involving her neck, her hands, her legs, and also some part of the face. So the portion of the dermatitis of the neck actually involves the 3-4 cervical 3-4 dermatom, and it's actually called Casal's necklace. Okay, and also the patient has, I've already mentioned, can have diarrhea and dementia. All of those are actually called pellagra. And the most common reason behind niacin deficiency are heart nerve disease, malignant carcinoid syndrome, and isoniazid. In case of heart nerve disease, there is actually decreased absorption of tryptophan, and the tryptophan is actually a precursor for niacin, so niacin level will be decreased. In case of malignant carcinoid syndrome, carcinoids actually produce a lot of serotonin, and as you know, serotonin is actually produced from tryptophan. So if the tryptophan are used for serotonin synthesis, there will be a decrease in niacin synthesis, leading to niacin deficiency. Isoniazid is a drug which actually used for TB, and this drug will actually reduce the vitamin B6 level, and vitamin B6 is actually needed for synthesis of niacin. Okay, so there will be niacin deficiency. So here you can see niacin is a part of NAD, NADP, and they actually produces 3 ATPs. And I have already mentioned that niacin is derived from tryptophan. And vitamin B2 and vitamin B6 are 2 important vitamins that are required for synthesis of niacin. Okay, and niacin can also be used as a drug, which lowers the VLDL and increases HDL. So it's a drug for dyslipidemia, and whenever you can use the drug, it can be taken in excess, which will actually cause facial flushing, hyperglycemia, hypotension, and hyperuricemia. The reason behind facial flushing and hypotension are same. They actually occurs due to excess production of prostaglandins. So prostaglandin can be produced excessively if a patient takes excessive amounts of niacin, or maybe normal amounts of niacin. So it is advised, especially for dyslipidemic patient who takes niacin, to take aspirin before taking niacin, and also if they also take antihypertensive drug, especially which are vasodilators like calcium channel blockers, they are actually advised to reduce their antihypertensive drugs concentration or dosing. And also they can cause insulin resistance, so they can lead to hyperglycemia. Okay, so antidiabetic agents should be actually balanced according to the blood glucose level, and also they can cause hyperglycemia. And vitamin B5 or pantothenic acid is another vitamin which can cause baldness, like in this patient, and it can also cause enteritis and dermatitis. So baldness or alopecia, enteritis, and dermatitis are the most common features, and is actually part of coenzyme A, which is a very important structure, as you know, from biochemistry, and is also a part of or cofactor for fatty acid synthesis. And vitamin B5 deficiency in some cases can cause adrenal insufficiency. Okay, so vitamin B6 are also known as pyridoxine, which is also a neurotropic vitamin, such as vitamin B1 and vitamin B12. So as you already mentioned, the vitamin B1 is actually responsible for neuropathy if there is B1 deficiency. So B6 deficiency will also cause neuropathy, which may be manifested as pins and needles, or burning sensation, or paresthesias. Okay, so B6 actually is activated as pyridoxal phosphate in the body, which actually cofactor for transamination reaction involving, suppose, some enzymes like alanine aminotransferase or aspartate aminotransferase. Okay, and also decarboxylation reaction, so splitting, cutting carbon. Okay, also some enzymes like glycogen phosphorylases also need vitamin B6 or pyridoxine, and very importantly, most importantly, synthesis of substances actually need B6 as a cofactor, such as cystathionine, heme, niacin, also serotonin and catecholamines and GABA. A long list, especially the first 3 are very important. Okay, next. So niacin deficiency, as I've already mentioned, can lead to peripheral neuropathy, and isoniazid actually is a drug which can cause B6 deficiency and can lead to peripheral neuropathy. And also I've already mentioned that B6 is needed for niacin synthesis, so isoniazid can also lead to B3 deficiency or niacin deficiency. Okay, and OCPs can also, oral contraceptive pills can also lead to deficiency of niacin. And I have already mentioned that niacin is an important cofactor for synthesis of heme. So if heme synthesis is impaired, hemoglobin synthesis will be impaired. And also, if hemoglobins are not synthesized properly, iron will not be used, so there will be iron excess in the blasts of the precursor cell, blast or the precursors of RBC. So there will be something called as sideroblastic anemia. Okay, and it can cause hyperirritability and convulsion. Just remember the facts. Okay, let's move forward. Vitamin B7 or biotin. You can see egg here, which is a raw egg, but this egg doesn't contain biotin. Actually, you shouldn't eat raw eggs to actually prevent you from biotin disruption. So actually the raw eggs contain something called avidin, which actually binds to the biotin and actually reduces its absorption, so you can get deficiency of biotin and you can get alopecia. So the ultimate take home point is, if you eat raw eggs too much, you can get bald in a very short time. Okay, so don't eat it. Okay, next is biotin is actually a cofactor for multiple carboxylation enzymes such as pyruvate carboxylase, acetyl-CoA carboxylase, and propional-CoA carboxylase. And I've already mentioned that biotin deficiency can lead to alopecia, and also like other vitamins, dermatitis and enteritis. And antibiotic use can also cause biotin deficiency along with ingestion of raw eggs. Okay. And I have one substance I have already mentioned. Avidin is present in raw egg, which avidly binds biotin and reduces the level of biotin. So now comes a very important vitamin, which is vitamin B9, also known as folate most commonly. And B9 deficiency actually causes macrocytic anemia. And here you can see in the left side a normal PVF, in the right side a PVF of macrocytic red cells, and normal cells are smaller and the macrocytic cells are bigger, and sometimes they take an oval shape, so they are also called macroovelocytes. B9 deficiency is also associated with hypersegmented neutrophil. Normally, you know that 3 or 5 segments are commonly found in neutrophils, but in case of vitamin B9 or B12 deficiency, you can have hypersegmented neutrophil, like this neutrophil has like 8 segments. Okay. And also, if a pregnant lady gets deficient of vitamin B9 or folate, the baby can develop some neural tip defects like spina bifida, like here, spina bifida, or absence of brain, also called anencephaly, or encephalocele, where the part of brain actually gets out of the baby's skull. Okay, so those problems should be countered by giving the pregnant woman a lot of folate supplement. Okay, so this is very important to know. And you can find folate in a lot of green leafy vegetables like those. You can note and you can eat them a lot. They are very good food. So you can advise the pregnant lady to take those fruits as much as they can. And folate actually involves multiple reactions, and one of them is synthesis of thymidine, which is actually a pyrimidine, and very important. You can remember you can actually see the resemblance of thymidylate. You can see that thymidylate is a very important substance which actually forms your DNAs. Okay, so you need to produce a lot of thymidine to produce DNA. And folate, if folate is deficient, your levels of DNA will be down. Okay, so cell replication will go down. And the way that folate helps to synthesize thymidine is actually it actually helps something called methylation of the uridine. So folate is actually first converted to dihydroxyfolate, and then dihydrofolate, and then this dihydrofolate by dihydrofolate reductase is converted to tetrahydrofolate, and tetrahydrofolate gets something called a methylene, and it actually acts as a donor of methylene to the uridine. So here you can see deoxyuridine monophosphate, which will be converted to deoxythymidine monophosphate, and for this conversion you need methylene, and this methylene is carried by tetrahydrofolate, and this tetrahydrofolate will actually ultimately go into formation of dihydrofolate, and by giving methylene to the deoxyuridine monophosphate, which will actually synthesize deoxythymidine monophosphate. Here we can see 3 drugs, which also very important to know. It actually inhibits dihydrofolate reductase, which regenerates the tetrahydrofolate from dihydrofolate, and especially methotrexate inhibits the hydrofolate reductase in case of human, trimethoprobin inhibits the dihydrofolate reductase in case of bacteria, and pyrimethamine inhibits the dihydrofolate reductase in parasites. So very important to know. And also note that thymidine synthesis can be inhibited by 5-fluorouracil, which is an anti-cancer agent. Okay, I think that should clear everything. And folate is also a cofactor, or folate is also a methyl donor in case of conversion of homocysteine to methionine. So as you can see here, the enzyme that converts homocysteine to methionine, also called homocysteine methyl transferase, and actually because it transfer methyl, and this methyl actually carried by tetrahydrofolate, and it gives methyl to the homocysteine and it converts to methionine. So very important to know. So if you do some lab investigation for folate deficiency, you will have an increased homocysteine, because as you can remember from the previous slide, that if folate is deficient, this reaction won't go and the level of homocysteine will be up. Okay, so very easy. And the methyl malonic acid level will be normal, and you will get the importance of this information later. And some drugs can cause vitamin B9 or folate deficiency, such as phenytoin, sulfonamides, and methotrexate. Just some facts that you need to remember, very important. And next, very important vitamin, which is B12, and along with B1 and B6. B12 is also a neurotropic vitamin, which can deficiency of which can lead to neuropathy. And B12 neuropathy is very specific neuropathy, which actually involves the dorsal column. Here you can see the dorsal column. Okay, and can also involve the lateral corticospinal tract, and that's why this is actually combined neuropathy, combined motor and sensory neuropathy, and this is called combined neuropathy. And also it occurs for a certain period, after a certain period of time of B12 deficiency. So actually it is subacute. So in total, the B12 neuropathy is called subacute combined degeneration of the spinal cord. Okay, and there are actually two main reactions that B12 takes part of. First of all, that I have already mentioned in tetrahydrofolate, that in thiamine, in folate, is that homocysteine conversion to methionine is actually catalyzed by homocysteine methyl transferase, which actually transfers methyl from THF to homocysteine and converts it to methionine. And B12 actually acts as a cofactor in this reaction. And also B12 acts as a cofactor for methyl malonyl CoA mutase, which actually converts the methyl malonyl CoA to succinyl CoA. So as you can assume that if B12 is deficient, both of those reactions will be down. So both of those reactions will be down, and that's why the homocysteine level will be up and methyl malonyl CoA level will be up. Okay, so this is important contrast to make between B12 deficiency and folate deficiency. If there is only folate deficiency, only homocysteine level will be up. So homocysteine level will be up only in case of folate deficiency. But in case of B12 deficiency, as the B12 is important cofactor for both of those enzymes and both of these reactions, not only homocysteine increases, but also methyl malonyl CoA increases. So as you get from labs is there is increased serum homocysteine level, and also there is increased methyl malonic acid level, which actually differs is from folate. And the most common source is animal source, and very important to know that, because if a person eats only vegetables, he will be deficient of vitamin B12, and your body sometimes can produce B12 from microorganisms. And another important reason for B12 deficiency is malabsorption, such as due to sprue, enteritis, feet stepworm, Crohn's disease, and also lack of intrinsic factor, which is also called pernicious anemia. There is formation of anti-intrinsic factor antibody in parietal cell of the stomach, and there is no intrinsic factor. And if there is no intrinsic factor, you can't absorb B12 from ileum, because intrinsic factor first bind to B12 and then it's transported to the ileum where it gets absorbed. So if there is no intrinsic factor or parietal cells are damaged due to autoimmune gastritis, you will have something called a pernicious anemia, which is another name for spatial B12 deficiency anemia. Okay, and if the Crohn's disease occurs, because of Crohn's disease there is damage of the ileum, so if ileum is damaged, you can absorb B12, and feet stepworm actually takes up B12, and if you have sprue or enteritis, you will also have decrease in absorption of B12. So that's all from me. Thanks for watching the video.